Okay, so this is the subject. Um, a few words about myself. I'm a physician. I served in the Israeli military for many years, dealing with emergency situations in hospitals and otherwise. This is my family, my grandchildren. I worked in three of the four HMOs, health maintenance organizations, that are actually the providers as well as the insurers in the Israeli healthcare system. I teach the subject of weapons of mass destruction and non-conventional warfare in Tel Aviv University School of Public Health in the program for emergency and disaster situations. I'm a consultant in research in a private medical research institute, and I also learn and teach mindfulness for physicians, which are really in need for support, especially in these times of Corona, COVID-19. Okay, so what are the types of events that hospitals and healthcare facilities at large should be prepared for? Those are the three major scenarios that we would like to be prepared to. They are all outside of hospitals. I'm talking about situations that are outside of hospitals, not emergency situations that are in the infrastructure of the organization itself. And those are the types. It's multi-casualty incident, or MCI, which means a disaster that caused a large number of casualties outside of the hospitals that are now being brought to us in the hospital for medical treatment. There is a massive toxicological event of hazardous materials that we can and should be prepared for. The issue of epidemics, of many patients coming with an infectious disease, like happening really nowadays with the COVID-19 outbreak, actually. And the radiological incident, if this is relevant, especially if there are facilities or industries in the vicinity of the hospital that keep radioactive substances, or if there is a nuclear reactor nearby the hospital. Of course, massive toxicological event can happen also from an industry that is located nearby the hospital, or transportation of hazardous materials that occur all the time with trains and with lorries on the roads. This is also a possibility that we should be prepared for. So those are the four prototypes of events outside of the hospital that might cause the hospital to receive in a short time many casualties for patients that need to be taken care of. This is the the look of the COVID-19 virus and the international symbol for biological emergencies. So most of the preparedness that we need to have is actually conceptual. We should be prepared. We need to think about those possibilities and to prepare for them. Now, there are many manuals and many doctrines and guidelines that are open in the internet, and even in the level of the country or the state. Many countries have their own guidelines that the authorities demand us to work according to. So actually, for each type of event, you can rely or take the guidelines of international organizations, especially the World Health Organization, of course, and then other organizations that are also can be helpful in establishing your own program, internal program for preparing, and also the guideline, as I said, of your country. There are the central the CDC guidelines, for example, that are relevant for the United States of America, but it's also a good plan to look at least to look at and to learn from, to establish your own flow and your own guideline to your own hospital according to the local conditions that you have in your own facility. Now, of course, knowledge is very important. We should have the basic knowledge, the basic medical knowledge as how to deal with those kinds of injuries. Of course, that's the basic, and we rely on our knowledge as physicians, as nurses, as to how to treat those casualties. A reference scenario is a good thing to have, like what is possible. Like, for example, does my hospital have to prepare to receive 10 casualties, 50 casualties, 100 casualties? Sometimes the local authorities instruct us, what to be prepared for. And sometimes we ourselves can decide what we would like to be prepared for. And this is especially, it should be in accordance with the size of our facility, how many beds we have, how many manpower we have. So a reference scenario is good to have. For example, if you have traffic of hazardous materials around in the area, one may want to contact local authorities and to learn what kind of substances are there. Like if chlorine is transported all the time nearby, we should know how to treat chlorine casualties. And what is the scenario? I mean, how many casualties can be from those amounts of chlorine gas that are transported nearby our hospitals? Or for example, is there a location with mass gathering of people like stadiums or other places around? So how many casualties can be there should like an event happen, like an accident, terrorist attack? All those scenarios we should really have in mind and to get them in order to be prepared. So actually the plan is to prepare to specific scenarios. Okay, so if we are preparing for multi-casualty incident, and if the scenario is that we should be prepared for 100 casualties coming within 1 or 2 hours, so this is the scenario we would like to prepare, and from this point we establish our own plan on how to deal with this number and this severity of casualties, types of casualties that might come into our hospitals. So that's how we build the plan, considering the scenario, considering what we have in hand, how many manpower we have, especially all kinds of manpower. Of course, everybody is important, not just the physicians and the nurses, but also the people who carry the stretchers and the logistic people. All are important to prepare for such a scenario. We should have an on-call system, like usually, you know, at nights we don't have many much staff in the hospital, just just a few people. So such an emergency, of course, can happen in the night or in the evening when we have less people. So we would like to have an on-call system to call physicians and nurses from their homes coming to the hospital, even give them means of transportation to reach the hospital quickly in order to build our manpower to receive the casualties that are on the way. We should have a notification system, like direct contact with the local emergency authorities, the police, the fire brigade, the ambulance service, so they can notify us as a hospital as soon as possible, as soon as they know that something is happening. Please be prepared. So we will have a little bit extra time, maybe even a few minutes is very important, as to how to organize to receive a large number of casualties in a short period of time. That's how we, sorry, that's how we build the surge capacity. Like we have in the routine days in hospital, like the beds, the number of beds that we have, and we can hospitalize a limited number of patients. But we would like to have the ability to open more beds and to treat larger number of casualties. Like if, for example, we know that an accident has happened and many trauma casualties are on their way, we may decide even to transform some of the internal medicine wards into trauma beds, and to in such a way to have more a place for trauma casualties. We would like to have maybe the ability to even open some more operating rooms. So we have extra capacity for making emergency operations. So all these things should be in mind when building a preparedness plan as to how to increase the capacity of our facility quite quickly. And this mainly depends on human resources, on manpower. We should be able to enlarge the number of caregivers in a short period of time, call them, and also we should have equipment, of course, more equipment to treat the specific casualties that we are about to accept. If it is trauma casualties, so more trauma equipment in the emergency room, and so that the operating rooms are already ready. And they have some more supplies, some extra supplies if we need them. Even maybe emergency beds that are maybe stored in a warehouse in the hospital that we can take out and put in corridors or outside of the hospital, even outdoors. If we don't have enough room inside the hospital, maybe even under the sky, but maybe have tents to open to enlarge the capacity of the hospital and open more hospital beds as needed. We should all think about those possibilities ahead and be ready with the equipment as well. Every plan should be also, now about the equipment, another point I want to make is that the other scenarios, like scenarios of an infectious disease or the scenario of hazardous materials, we should also think ahead if we would like to have like antidotes for hazardous material at place, like for example, atropine for organophosphate poisoning, which is quite a common possibility of hazardous materials, antibiotics for some extra amount of antibiotics for infectious disease possibilities. So this also should be in the reference scenarios, so we can, according to those scenarios, build the capacity that we would like to have for an emergency situation. Now, every plan should take into account that many people can arrive at the hospital once the media announced like an accident has happened or an emergency or a disaster has happened. And many people, of course, will have a lot of anxiety, fear. Some will come with all kinds of symptoms and signs, for example, that are not caused by a physical disease, but maybe by being very anxious. So we should put in the side some possibility of like people who can deal with those people. So they won't put a lot of burden on the account of the really severe injured patients, like having like a social worker or a nurse in some room that can talk with such people. They should really get also the attention they need. Also, people will come to look for their relatives. I mean, people might think that the relatives were hospitalized. It can happen in minutes, and many people will come to look for the relatives. So we should also have the room, the extra room that is dedicated for those people with the hospital computer, with the lists of the patient, the lists of people that were hospitalized just in the last 1 hour, for example, and being able to help and give information for those worried people that are looking for their relatives in case of a disaster. Now, once you have a plan, like you go from general guidelines, like I said, to a specific doctrine or a specific plan. Every plan, it is good that it will have the chart of the casualty flow, like where do the casualties go, where is the emergency room, where do they go from the emergency room, to the operating rooms, what is the way, what are the corridors. This is especially important in, like you see in the picture, is a scenario or a drill that actually was done in our country, in Israel, when a hospital was prepared for a chemical event, chemical emergency, hazardous materials emergency, that in the entrance to the emergency room, we opened a washing area that people can be washed, can be undressed and washed, because they might be contaminated with all kinds of materials that we don't want them to enter those materials into the hospital. So being prepared for such a scenario of hazmat materials, it is important to know where is the decontamination taking place. Is it taking place in the field, like where it happened? This is one possibility. And the casualties are arriving to our facility already clean, like undressed and clean. Or if this is not the case, it is really good to have some shower heads and some hoses with water in the entrance to the hospital. So in that area, people can be undressed, washed, and enter clean to the hospital. Otherwise, those patients might contaminate our own emergency room and the wards, and this is very bad. Like, this is very bad because our own staff can be affected as well. They might get poisoned for those materials. So it is very important to have a very strict flow of patients, and the definition what area is considered contaminated, preferably outside of the emergency room, and from what place the area is considered clean or not contaminated, which there the staff can work without any protective equipment. So the staff that receive those patients outside maybe of the emergency room, they should be protected by protective gear, masks, and protective equipment, so they won't be affected. So this is for the possibility of chemical emergencies or hazmat emergencies. It is good to have for every staff member a designated position. So if he's called or she is called from her home in an emergency in the middle of the night to help the hospital, she should know in advance what is her position in the hospital. Where exactly does she go, and what responsibility does this specific person take? So it's very good to know in advance what is the role of each member in an emergency, because in an emergency there might be a lot of chaos. This is why it is very important to have a specific plan ahead that you can take out of the drawer and implement it immediately. Open the papers or open the computer, look at the plan and work according to the plan. Have checklists, to check that we are doing everything that we should do, one thing after the other, like take out the equipment, put the people in place, give them their own equipment, give them a short briefing for a few minutes, what is their role. It's very good to have a checklist. I had once heard, and this is, I think, very, very good, from a person who was the Surgeon General in Israel and had lots of experience with emergencies. And he once told me, you know, in an emergency, your IQ drops to the ground. I mean, you might be in a blackout. Everybody can be, even the most experienced person can enter a blackout in an emergency. So it's very good to have checklists in advance. You take out the checklist and you're working according to the checklist. Checklist, of course, is one of the, let's say, chapters that one should write when writing a preparedness plan. The preparedness plan should have all those areas covered that I talked about: the manpower, the equipment, the flow, and of course, checklists, very important to have there. Once you build your own plan for your own hospital for those scenarios, best to do it with people with experience, you know, with hands-on experience. People, you know, who work in the emergency room, who are surgeons in the hospitals, or the head of the infectious disease unit if you're dealing with infectious, with a biologic event. The toxicologist of the hospital, of course, if you want to be better prepared for a chemical emergency, this is best. And then once you have the plan, you establish the plan, you start guiding the personnel in the hospital. You have them read the plan, learn the plan, talk about it, instruct them about the plan, have lectures given to them. Sometimes, and we do it in Israel, there are lots of softwares that the personnel should go through and learn from the software, like computerized learning, as to how to be prepared. Like some of those can be interactive, graphic, with lots of pictures of the organization of the hospital. This might very be helpful in being better prepared. After the people are learning, they know their roles, they know what they have in hand, they know what do they have to do in an emergency. Exercise them, have a drill. You can start from a simulation, like taking even the management of the hospital and have some drill, like a round table drill. Bring a scenario to the table and ask the managers of the hospital, how are you dealing with such a scenario? What are you doing? So you can simulate with them the situation, and then make even a field drill. Have a dedicated time that you clear in advance, stop for a few hours, even the planned activities of the hospital, you know, the ambulatory activity, the scheduled operation for 2-3 hours, and build the drill. Put everybody in their positions and simulate what we will really do in an emergency. Use all the things that you have, open the computers, enter like maybe fictitious patients into the electronic medical records. Have people go through the flow of the hospital so this is how you really can check also, not only exercising the staff that you have in the hospital, but also for yourself to check if your plan is real, if the plan is relevant, does it give answer to problems, and is it really possible to implement such a plan in the hospital? Is it real? This is very important to have some time doing exercise. I think that's it. So I really would like to hear from you, maybe a little bit on your specific situation in your hospital, in your area. Do you have such preparedness? Are the authorities asking for you to be prepared? And if you have questions about what I talked just now, I would
Thank you very much, Yoav. Any questions?
Please feel free to ask anything. Do you have any issues, any challenges, or any issues that you're not sure about, or have some advice, about anything that you have in your specific area, your specific hospital?
Apparently not.
Yoav?
Oh.
Yes.
Maybe I can ask. My name is Ayelet. I head the Trade and Economic Mission here in Ghana. This session is part of a training that is done towards designing and opening new hospitals, actually a chain of hospitals across the country, part of the president's agenda to make sure that the whole country is covered with hospitals and everybody has, has where to go in case of need or emergency. And my question was, are there any specific issues that you think need to come into account when planning and designing a hospital, even from the architectural perspective or anything like that, that should take into account this time of emergency already in the design process?
Yes, there are. I think it is important to learn from the local authorities. Do they have any demands put on this hospital system? Like, do they instruct those facilities to be prepared for anything, like, or they leave it to their own decision? I mean, if there is a guidance from the government, like the government can say, I want your facility to be ready to accept such and such casualties. So you may try to adapt to that demand or that possibility. An important thing is to know, as I said, about hazardous materials preparedness, like what is the doctrine in the specific country. In Ghana, I understand, like, do they, if they have such an emergency, do they decontaminate people in the field, in the area of the accident, or do they not? If they not, then it is good to, I think it is good to have a plan for the infrastructure to include like a small washing facility in the entrance to the emergency room, like have water supply built in that area, and to designate a specific area. It can be in the parking lot. It can be right just in the entrance to the emergency room with some water supply to allow for decontamination. This is one thing. And of course, like, what is the extra equipment that you need to have? Like, if this is a 100 bed hospital, and the government would like the hospital to be prepared for 150, so you need to have extra 50 beds in the warehouse. And you should have area to store like extra equipment.
Great. Any more questions to Yoav? Okay, if not, so, there's a question in the chat, Yoav.
How do you go around emergency situation in, for example, rural areas where a lot of people can, well, you know, if the facility is in a rural area, and the tertiary hospital is very, very far away, like in the capital, or very, very far away, and you need to be independent in the area. So this really say that you need to have all in place. You know, you should have more. You can't build on getting more equipment from the outside or getting more people from another place. You need to account on your own wherever you have. So try to build a plan that take this into account, that you need to be completely independent, like everything have in place. You don't have, you can't have everything, you know, but at least the basic support that should be given to patients, and take into account if you have some very severe casualties that you can't operate or deal with in the place, have maybe a plan to, you know, to transport them to another facility far away if you need, for very complicated surgery, for example, if needed.
Okay, so thank you very much, Yoav, for joining us today. We'll start moving. Thank you so much. We'll move to the next part of our session, and it will be the solution part for medical companies in Israel that will be joining us. Yossi and Shauli from eWave Medical, please, the floor is yours.
Can I share my screen?
Yes, I think you can. If not, let me know. Yes.
Then, איך אני עושה Good. Thank you very much. My name is Yossi Jan. I'm the CEO of eWave MD Medical. Can everybody see my screen?
It's small. Just if you can make it bigger.
One second.
Yes, now it's good.
Good. My name is Yossi Jan. I'm about 30 years in the health sector. Used to work with Dr. Yecheskel, Yoav, and I've been the CIO of Maccabi Health Services in Israel. And actually from 1989 till 2009, which is 20 years, I've been building the whole information technology system of Maccabi. Now I'm the CEO of eWave MD Medical, which is a well-established company that is working on national e-health solutions to different countries. And I'm a bit challenged to speak in 7 minutes about everything that we do. So I picked three issues or subjects that I want to talk about at this session. First of all, we are looking at information technology in the health market as enabler to better healthcare for the people. And the first subject that I wanted to talk is integration among all caregiver by using electronic medical record and in specific and in general and IT systems. The usage of telemedicine for remote area, and I've seen the question that was raised before, and I will give an answer to that. And of course, in time of COVID, the usage of telemedicine as the need of telemedicine increased at the time of COVID-19, and use of advanced medical monitoring tools for home care or even in hospital. The fact that the 111 health facility that you are going to establish will be combined from hospital, from primary care, from telemedicine clinics with only nurses, from laboratories, pharmacy, and so many. What we have is one platform that connects every entity to one you can see that in the bottom, one main database on the cloud that enable merging of all data and doing communication between all of those entities. I will give two examples. A doctor can refer a patient to do a laboratory test. The referral will be shared in the laboratory where the patient is going, and the results will be transferred directly to the medical record of the patient. So every caregiver that will take in the future, take care of this patient, will see the data in the medical record. Among hospitals, people can transfer between hospitals and can be sent from one hospital to the other. No need to collect all over again the old data and doing deep anamnestic with the patient. All data that is available in the network will be presented to the doctors or the team, medical team in every hospital in the country. The same goes with the telemedicine. Clinics in the remote area where you do have a general practitioner or you don't have and you have only nurses, all data that they are putting into the system is being stored in this main medical record. We call it a national medical record. Of course, all of those technology that we are putting in is also for the benefit of the patient. So a patient can have an access through a website or through his mobile phone to see all his medical data, all his interaction between doctors and administration and scheduling for appointment. All of those features are to support the patient and to empower the patient while is part of his medical record, his medical care. The first, sorry, this is, and I can share with you this presentation. This is the whole wide range of product that we are supplying in our country, in our company. Feature for the primary care, for the secondary care, for telemedicine, telediagnosis, healthcare administration, patient-centric and pharmaceutical area. All of those products are available and working in the field. One of the products that I want to show you is our electronic medical record, which is being shared between a telemedicine station, primary care, and hospital, where we are putting different engines in the medical record. One of them, and I will give only one example, is the health promotion engine, which allows the Ministry of Health to decide what kind of health promotion he wants to promote in the country. For example, diabetes patient, every 3 months, we want to do an hemoglobin A1C test. So whenever a diabetic patient comes to his doctor, the system will check up if he has hemoglobin A1C test from the last 3 months. If not, he will pop up a message to the doctor to send this patient to do a laboratory test. And so many, we're doing mammography for women over the age of 50. We are doing ophthalmology tests for diabetes patients, really many more. Like we have in Israel over 100 different health promotion rules in the medical record. So this is available in the level of primary care, telemedicine, and hospital. We have our own platform of hospital management information system. I know that all those icons are very small, but anything that you can imagine that hospital needs to do over an IT system, you have it over here. I've put 2 slides that enlarge the modules. These are part of the medical modules that we are supplying in our hospital management information system. For sure, the electronic and medical record that you already seen part of it, laboratory, operating theater, blood bank, emergency room, outpatient, inpatient, ambulances, doctor's module and nursing module, all are available and integrated all together. From the other side, we have all the administrative module that is supporting the money flow, the reception, insurance, billing, pharmacy, which is very complicated module. How do you supply medicine to all wards of the hospital? Staff management, shift management, HR, payroll, inventory, purchasing module, even laundry and kitchen, where you are keeping all the data about the kind of food that you have to feed the patient with the low salty, low sugar, and so on. And a full solution for financial needs. This system is working in more than 10 different hospitals already, and it's available to use even in your future network of hospitals. The telemedicine solution in remote area, we have a special device that enable a nurse or a general practitioner to look at your medical record, to collect data from the patient, collect data by using medical devices that are affordable in those remote areas, like blood pressure, like glucometer, thermometer, and some others, and send the information immediately to the medical record, being monitored by doctors in call center or in hospital that can consult hospitals directly if they need a specialist from hospital. So in one session, we have a diagnosis and treatment for a patient in those remote areas. We can and allow those nurses to mark cases or consultation requests as urgent. So it will be up in the priority of the doctors that are supporting the telemedicine. This system is working in the Amazonas in the north of Brazil, really remote location where they have very nice clinics with only nurses. Doctors are coming once a month, once in 2 weeks by boat. And using this system, they are getting real-time medical care services. One of the unique capabilities of—
We have to wrap up.
What?
We have to.
That's my one before the last slide.
Okay.
What we do with this system is 3 channels of video where the patient can see the doctor can see the patient, and there is medical camera that is connected to our device, so both of them can see throat, ear, skin, and so on. Our last product is monitoring of patient. We are doing telemonitoring of COVID-19 patient, where you see all the measurement that we can do under the green square. It's really exactly like in intensive care unit. So even if the patient is in intensive care unit, we are taking all those measurements without the need of nurses going in, risk herself to be infected, and take those measurements as well. This is the central. We can monitor up to 400 different patients in one of those monitors. And there is a lot of artificial intelligence in this system, where a patient with low oxygen in his blood or high temperature automatically will come the first line, and there will be hazard to the team. And one last thing, we are supplying vaccination management system to different countries to support the vaccination from prioritization of the citizens, scheduling, vaccinating, doing dashboard for the ministry, and the green passport. Thank you. I've done my 7 minutes. If there are any question, this is our website. Go in and you can see everything that we were talking about.
Thank you very much, Yossi. I'm afraid we don't have time for questions. So anybody, if you have questions, please raise them on the chat, and Yossi will be here with us for the next few minutes to reply. Next, I will be presenting Mrs. Angela from Innovitech company. Angela, are you here with us?
Yes, I'm here.
The floor is
Thank
yours.
you.
Thank you.
Okay, let me see. I would like to share my screen and we'll start. Okay, you can see my screen now, right?
Yes, you can make it bigger, maybe.
Sure. This way? Okay.
It's okay. It's not a full screen, but it's okay. You can go ahead.
Okay, good. Thank you very much for inviting us for this meeting. We are happy to present Innovitech for such unique opportunity. So really to do my best to be on time also, I'll go right away about who we are and what we are doing. So Innovitech is in the field of manufacturing and designing the medical devices for in the areas of respiratory and cardiac distress. Our roots are in the military medicine, and with the years we've developed and adapted our technologies also for pre-hospital EMS world, and during the last year we also developed devices applicable into the in-hospital environment, and you will see them really very soon. So Innovitech was established more than 10 years ago. Today we are handling 3 different product lines, and we are commercially available in more than 20 countries. And yes, since our first day, we are supported by the team of a scientific advisory board. All of them are experienced doctors in disaster and preparedness and emergency medicine in Israel, in Germany, and the United States. And here you can see shortly about an introduction of our product suite. First of all is the Ventway Sparrow, the family of the lightweight and high performance turbine-driven ventilator. We will talk in more details about it very soon. We do have another family of tools to handle the airway management. It goes by the name of Lubo. It looks like a cervical collar. You can see here in the middle. However, it's actually a device that enables to open the airway and to keep it open for a prolonged period of time. And it used to be placed in the ambulances for mass casualty events and pre-hospital management. And the third product is Sally. Is the second, I would say, kind of a next generation of AED, which actually helps to community members to provide the first medical support to a person which undergoing any kind of medical distress, not only sudden cardiac arrest, but also, for example, depression of the respiratory system, suspected stroke, or maybe some kind of mental illnesses, any kind of medical distress out of hospital can be supported today with the SALI, and SALI is the only system in CE area which also provides the respiratory treatment on the ground by any person, not necessarily the medical or someone who has previous medical education. So let's drill down onto the Ventway Sparrow. Really,
Angela, I'm sorry to bother you, but the presentation is stuck. Maybe you should do a stop share and then share again.
Okay, let me check it again. Can you see it now?
Now it's
okay. Okay, so you see now the family of the Ventway Sparrow ventilators. It's one of a kind, really ultralight portable ventilators, which actually designed specifically to provide the high performance ventilation in different settings. You can see them looks like very similar to one another. However, all of them are developed are made of different materials, supported by different softwares, and stand under the different standards. For example, the military unit supports also kind of the unique features that required onto the military medicine and tactical medicine. The Ventway Sparrow MR is the only one which actually goes together with the patient onto the MR chamber. The EMS model stands on the strict standards of ambulances and air ambulances, and the fourth model, which is under development now, would be commercially available early next year, would be for the ventilated patient at home, to provide actually the greater mobility for any person who's actually goes with the ventilator 24/7. All those products are FDA approved, CE mark, and also has regulatory approvals in different countries like Australia, Mexico, Brazil, and Argentina, and the UAE, and these days we are undergoing registration in Japan and China. So during the last year, let me see if I can go. You can see the next slide right now. Yes, good. So here you can see the uniqueness of the Sparrow. It's not only being very light one, which is weight only 1 kilogram, but also being the high performance ventilator, very intuitive to operate, robust with minimal requirements for the maintenance, and really very good one for the emergency preparedness. And also it works independently of any electrical or oxygen infrastructure. It can be operated with rechargeable and non-rechargeable batteries. And here aside, you can see the entire kit that is used to be provided for the out of hospital mechanical ventilation. As we've been requested to also integrate onto our presentation some case study or feedbacks or use cases from the hospitals. I've got here a few of them, one from Israel, from one of the leading medical centers in Tel Aviv, which operates hundreds of operations and provide ventilation and use the Sparrow for the patient transportation within the hospital. Another one is here from the South Africa, which also used to support intensive care unit requirements during the COVID. So you will be able to see all of them. I'll share with you the presentation so you can go through these video files, just to let you see also that the Sparrow also supports the high flow nasal cannula mode of operation. And if there are doctors among us in this meeting, so you can understand that many COVID patients required HFNC mode even before they go onto the ICU unit. Just really shortly, during the last year, the event with Sparrow has been picked up for as urgency for a COVID response in UK, in US, in Russian Federation, in South Africa, and many other countries. We, of course, learned a great lesson during the last year, as we had to be in many new environments, in many new end users without ability to send our trainers. And then, of course, we've developed a batch of training and maintenance materials that helps our end users to actually adopt the Sparrow very easily onto their routine medical practices. So here we are, and just a few strategic partners of us that work with us from the day one. And I'll be happy to provide more details about the Sparrow or other products of Innovitech in one-on-one meetings if would be interesting.
That is great. Thank you so much, Angela. You are welcome to share with us the presentation in the chat. And if not, just send it to me and I will share it with the participants.
Okay, I'll send it over to you.
Yeah. Yes, and if anybody has questions, please raise them on chat since we're a bit late. And moving on to Shmulik from Identity. Thank you, Angela, again.
Okay, I'm with you. Just a minute, just to find the presentation. It's always that. No, it's not. Sorry. Oh, here it is. You see my screen? Yes?
Yes, we do.
Okay, fine. Okay, my name is Shmulik Beckerman. I'm the VP of Business Development and Sales in Identity Healthcare. We are a public company, Israeli public company, just recently. And just to introduce the company, we are a software company with a combination of hardware. And we work with hospitals and clinics in order to improve their efficacy. This is one thing. We work all over the world, but we have started, and the main activities that we have had till now is in Israel. We have presence in mostly all hospitals in Israel, including the private hospitals and the surgical hospitals. And all of our solutions are already there. Okay, now I think that's better that you see the screen. Okay, let's talk about the company and the solutions. The core of the solution that we have is a software in the cloud. It's important to discuss the cloud because the cloud is the key for the solutions that we have, since we share the information between hospitals and the vendors, so that we are a kind of a platform to all the links in the supply chain in order to improve the flow in the supply chain and improve the efficacy of the operating rooms and the procedural rooms. This is okay. So I'm talking about hospitals, but we focus mainly in operating rooms and procedural rooms. And as you see on the left side, what we call the hardware that we install in hospitals, we call it sensors, since they collect the data. the data that is collected from the production in hospital, which means the operating room and procedural rooms, the data is digested in the software in the cloud, and then is sent back, whether to the ERP or the EHR of the hospitals, or the information is also depends on the approval, of course, from the hospitals, is sent also to vendors in order for them to control the stock. When I get to the smart cabinets, you will understand what I'm talking about. But just, you know, to see the layout, that this is the flow. We are in the middle, playing between the hospitals and the vendors. We have several solutions, as you can see here in this chart. One of them is the Snap and Go, which is data collection in the operating room and procedural room. Use image recognition. The other one is Smart Cabinet, based on RFID technology. Third one is narcotic cabinet for anesthetist, and for you know, to follow the regulation and to avoid stealing, misusing, whatever. The Kanban on par level solutions are solutions for managing the disposables in the wards. And the third one is actually a wide range of solutions based on mobile application. Okay, now I'm going to go through every solution that you saw in the last slide, and just you know, explain what it is. The main problem of the operating room and procedural room in hospitals is that it is managed by the medical staff and not by logistical staff. And the medical staff is trained to give medical services. The problem is that they also have to do logistic activities, because it's you know, it's the operating room is like an industry, and they have to. There are a lot of operating missions that to be executed, but it is supposed to be executed by the nurses and by the physicians. One of the main goals that they have is to document the usage in the operating room. In most of the hospitals, or all of the hospitals in the world, it is based on barcode scanning. And the result is very poor, just because there are a lot of problems in the barcode system. And actually, the rate of documenting in the hospitals is very poor. And we bring something else, a different angle of documenting the usage by the Snap and Go, which is a camera that takes a picture of the text on the label of the package. The nurse just gets a green light, and everything is done in the background, behind the scenes, in our software, or maybe in the office, so that after digesting the information, we send a full record of every item that was used during the operation. And this is a game changer in the world. Currently, it's a new solution. We have installments in some hospitals in Israel, and the plan is to, the next phase would be the US. The smart cabinet, when you call smart cabinet, actually the smart is in the software. This cabinet is, let's say it's a cabinet with antennas that can communicate with the RFID tags. We changed the ecosystem in the Israeli market by changing the system to pay-per-use, meaning that all the expensive items are stored in most of the hospitals in our cabinets, the vendors attach the tags and associate the item record to the serial number of the tag, and the items are sent from the logistics center of the vendors to the hospitals directly to the cabinet. Every item that is in the cabinet is recognized by the cabinet, and it's also in our software. And every use of an item is reported through our system, and therefore we close the loop. And since we have an interface to the ERP of the hospitals, we also give them the information in order to generate a purchase order to the vendors, in order to generate invoice, whatever. But as you see, the inner shelving is different between the packages. And as I said, we have hundreds of cabinets here in the Israeli market, and we also won a big tender in France. This is a very friendly system that can be used for all the procedural room and operating rooms. The next solution is the narcotic cabinet. Actually, this cabinet is, we didn't invent the smart cabinet for narcotic, but it is according to the regulation. There's no way, it's not something that they can prove ROI for this cabinet. It just follow the regulation in order to replace the system, or if you call it a system, the way that pharmacists versus anesthetists use the narcotic or controlled substances right now, which is in their pockets or in a small safe or whatever. This cabinet, every pharmaceutical is in a specific compartment, and when the physician or the anesthetist wants to take pharmaceutical for an operation, he recognizes himself, recognizes the patient, and then he has a kind of a menu, very friendly user face, when he can choose all the pharmaceutical controlled substances that she wants to have for the operation, and then closing the loop once the operation is finished to store it back. Yes. I don't hear you. Repeat again.
I'm sorry, we have to wrap up. So last slide, please, or
okay.
summary.
Okay.
Thank you.
This is the final one. Number 11 is for running the disposables. It is based on several solutions, which is restock tags or stock box or weighing system or mobile application, everything. So the bottom line is that we are coming from the angle of operation in hospitals. We give tools to hospitals to upgrade their ability to serve the operating room and procedural rooms, and but while having accurate stock and having the ability to move to pay per use, and not buying directly used stock with the risk of losing part of it from expired items or recall or whatever. That's it.
Thank you so much, Molik. If you would like, you could set the presentation, either leave your email or a web address at the chat so that people can reach you. And if you would like to stay for a few more minutes to see if there are no more questions for you guys. And moving on to our next session by Professor Arnon Afek. Professor Afek, are you with us? I think he should be here. So I'll present Professor Afek in 2 minutes. He's the Associate Director General of Sheba Medical Center and the Acting Director of Sheba. we have great privilege to have Professor Arnon with us today in the midst of COVID-19 and the fight with the pandemic. Professor Afek, the floor is yours.
Professor.
Yes, now I'm here. I had some technical problems, but now I think things are much better. Let me share screen with you and show you our presentation. Okay, share screen.
You can make it a full screen.
That's what I'm trying to do now.
Yeah.
Is it okay with you?
Yes, this is great.
All right. So again, thank you for the opportunity to speak with you. I'm going to present you today a case study of Sheba Medical Center in the COVID-19 response or epidemic. As things are not following the time schedule, do I have half an hour?
Maybe even more. We have up to 40 minutes.
All right, okay, because I'd like to follow up the timetable. So I want to thank Professor Eyal Leshem for assisting me in preparing this case study. I'll start by speaking about Sheba Medical Center, my own hospital, the COVID-19 as a case study, innovation during the COVID-19, what we did internationally, because we do believe that humanitarian help and international collaboration is critical. I'll continue by speaking about leadership in the vaccination and what we are doing now regarding what we have now is the fourth wave of COVID-19. So Sheba Medical Center is a patient-centered care with national and international impact. It sits here at the middle of Israel, not far from Tel Aviv and from the Ben Gurion Hospital, Ben Gurion Airport. It's on 200 acres and includes both comprehensive services, including rehabilitation and general hospital. And our vision is, of course, to lead internationally and to change the way medicine is practiced. And what we believe is that hospital, which is the classical hospital, which was the place for people who were sick to come and get better and live, should change its structure so it will become a city of health, promoting also prediction who's going to be sick, prevention of disease, treatment, and of course, rehabilitation, of course, all of that together, research and so on. So our hospital has more than 9,000 employees, 1,800 beds, 50,000 surgical procedures, but not small surgical procedures. The only cholecystectomies we are doing here is just to have our residents study and learn. What we do are very, very complicated surgical procedures like Whipple operation, lung, renal transplant, orthopedic oncology surgeries, abdominal surgeries, and so on. 11,000 births, 1.5 million ambulatory visits, and remember, Israel carries just 9 million people, and 25% of all the clinical studies of Israel are being conducted in Sheba Medical Center. And for the last 3 years, we've been declared one of the 10 leading hospitals in the world, the entire world, by the prestigious American journal Newsweek. So it was just logical that once the pandemic broke out in December 2019, it was the Ministry of Health and the person who replaced me as the Director General of the Ministry of Health before I came to Sheba, that asked Sheba Medical Center to take out and to lead the Israeli preparedness for COVID-19. Do you remember such a ship as the Diamond Princess? Well, it held Israelis there, and they were evacuated and came to Sheba. Once they came to Sheba, we opened the first COVID-19 ward. At that time, we didn't know anything. The entire world didn't know anything. So we did a lot of procedures and a lot of security measures we took. But at the end, we not just took care of these patients, but also helped other hospitals and also the Palestinian authorities to prepare themselves for COVID-19. And as you see, the former Prime Minister of Israel, Mr. Benjamin Netanyahu, visiting the first ward in Sheba and helping us and to promote the preparedness of Israel through Sheba. But we very soon realized that this is not enough. And what we will have to do is to prepare place for severely sick patients. And we opened the first Corona intensive care units in our underground parking, which were transformed to COVID-19 intensive care unit, more than 90 beds. And it's incredible to see how fast we reacted. And if we started with about 86 intensive care unit beds, with the help of our logistic people, we were able in just few weeks to create more than almost 400 intensive care unit beds. You ask me, Arnon, where did you find the staff to take care of these patients? Well, the truth is, we didn't just staff it, of course, with intensive care unit specialists and nurses. We use from the entire hospital, from the different wards, from the internal medicine wards, but we were able to staff all these beds. Luckily, we did not need it. We ended up, I think, at Sheba with 150 patients, no more. But we didn't end up by opening these wards. We opened the first pediatric unit ward, including here, what you see here are medical clowns dressed at COVID-19, the first psychiatric unit, and also took a very important part in the Israeli media campaign toward the preparedness to COVID-19 at the national level. And Israel recognized the contribution of all the hospitals, and especially of Sheba Medical Centers, by the national traditional flight of the IDF Air Force at our Independence Day. They flew all over the Israeli hospitals, including, of course, the Sheba Medical Center, where the general, the chief pilot of Israel, the head of the Israeli Air Force, stood and saluted his planes while flying over Sheba, and of course, many other awards and recognitions for our first, the head of our infectious disease unit, Professor Rav, who lighted one of the torches of our Independence Day. But you will tell me, okay, so you led and you gave and you did and you helped, but where does it, but show us something else that the rest of the world didn't do. Well, let me show you what we did, which is much, much different than any other places to my knowledge. We have at Sheba an innovation center called ARC, Accelerate, Redesign, Collaborate, which takes out information regarding digital health and creates an innovation hub to have every person in Israel and in the world who has a company, a startup, and wants to work within Sheba, he's welcomed here. We give him the open access to our data. He can work from here. And if, of course, he'll do an exit, then, of course, we'll join some of the fruits. If not, then it will be one of the startups that didn't make it up. So including our collaborators, apart from the different universities in Israel, also startup companies, leading startup companies from Israel, but also leading companies in the entire world, like Microsoft, AstraZeneca, Johnson & Johnson, and also leading international centers such as Cedars-Sinai, Mount Sinai, Mayo Clinic, Sunnybrook, and Jefferson. And the American that showed the Sheba's model for innovation center decided to build in Chicago such an innovation center, and already the agreement was signed. So at the beginning of October, we believe that they will start constructing the innovation center in Chicago based on the Sheba model. But once Corona started, we realized that having an innovation center can be used to fight Corona. So we transformed the innovation center to Corona Innovation Center and took on so many startups, inventions, and early companies, and let the companies use their stuff for Corona. For example, TytoCare. They produce different devices that help us to monitor people at their own homes. EarlySense, another company that creates an alarm system that you don't have to enter the bed and you see it all from your computer. So we didn't need to expose. This is what you see in the middle is the robot. A robot can go by itself from bed to bed and give the information to the control center outside of the Corona ward, and also home care through our most sophisticated devices. But we also shared information with our allies and friends throughout the world. And this is a very nice story I want to share with you. So this guy dressed in green, not the army officer near him that you can't see his face, but the other person, is a second-year resident in orthopedic surgery. His name is Amit. Amit, I don't know how many of you remember, but during March, you couldn't buy a ventilation machine. You couldn't buy it. So what we did, and he took a friend of him from the army, and they found a way to transform non-invasive ventilation, a BiPAP, into ventilating machine. And within a month, we had 100 new invasive ventilation machines, a great invention that helped us overcome the Corona epidemic. And the army, seeing that Sheba Medical Center is a leading center, set up its main control room, the National Command and Control Room in Sheba, and use all its assets in order to help Israel overcome the Corona epidemic. But as I told you, we share this knowledge with our friends and allies from the Emirates, from China and Japan, and many, many other countries who wanted to learn. We send missions while Italy was in the middle of a terrible third wave, and we in Israel overcame our third wave, we sent a delegation, a mission to Italy, which helped them fight the corona, and another delegation sent to Uruguay, help the Uruguayan people fight corona. We sent stuff to Nepal and many other places, and that was transformed, of course, into articles in the leading journals in the world. Whatever regards the third wave and now we realize that the only way to stop the third wave is by leadership also in the vaccination. Because we realize that the only way to stop the third wave is through vaccination. Now, Israel has huge advantages in vaccination. First, we are a relatively small country. We have just 9 million people. We are of a very, very small size, like Rhode Island in the USA. And we have a very, very good logistic background and very, very good logistic apparatus. So we were able to vaccinate up to 200,000 people per day. Remember, Israel is just 9 million people, and not, of course, everyone can get a vaccine or can be vaccinated, because when we started, only people above the age of 18 were able to. Afterwards, it went down to 15 and now to 12. And Israel, by the way, has signed an agreement with Pfizer to be a test case for the entire world with the Pfizer vaccines. But we realized the importance of us leading also the vaccination in Israel. And even before we had the Pfizer vaccine, we helped the Israelis, we helped the Israeli Biological Center to develop an Israeli vaccine. But once the Pfizer vaccine became very valuable to Israel, it was Prime Minister Netanyahu at that time that came to Sheba to be vaccinated. Also, other leading people from the Israel. This is the head of the Israeli police, the commander of the Israeli police. And we didn't end up with just vaccinated people, but we published many papers in the leading journals in the world. And here, for example, we show that even a single Pfizer vaccine can reduce the symptomatic COVID-19 by 85%, which was very crucial to the British who could not vaccinate their entire population like Israel. So what they did is they gave first vaccine to many people in order to save as many. This is the list of articles we publish from Lancet, from Emergency Infectious Disease, and also from other leading newspapers, medical journals in the world. So when the third wave ended and we were able to vaccinate more than 5 million of the Israelis, we were thinking that maybe Corona is over us. But the truth is, as Winston Churchill said, that this is not the end, not even the beginning of the end. It was the end of the beginning. And it didn't take long until we found ourselves with the fourth wave of Corona, the Delta infection. And the number of confirmed cases in Israel has been growing up. And but we were able to show that with time, there is lower antibody response. This is an article from Sheba Medical Center published in the New England Journal of Medicine, the leading medical journal in the world, and you can see that people who were vaccinated and had antibodies level, those who were vaccinated and had less antibodies were more prone to be sick. So it didn't take Israel time, and again, to lead the world in our decision to give a third vaccine, a booster to our people. And here you can see our president at Sheba Medical Center. He came here to get his booster, his vaccine. President Herzog with the First Lady Michal Herzog, and not just them, but also the former Prime Minister, now the head of the opposition, Mr. Benjamin Netanyahu, and his wife Sarah Netanyahu were here and got the vaccine. So how things will go from now, I don't know. But we understand that one thing is for sure. We need to be very, very adaptive, to change ourselves, to use innovations, to use technology, to use the brain of our people, which is our biggest and most important asset. We build the Innovation Center for the main reason is to see that the best Israelis people, the best Israeli physicians, nurses, PhDs come to Sheba, not just because we understand that the new Y generation, it's not enough to tell them, come to Sheba, work with us. What we have to do is tell them, you have a startup, come to us and use our facilities to make your inventions, to make your dreams realize them. If we do that, we will be able to get the best people in the world. And that's exactly what we did. We used it for Corona, but we are doing it for many, many other things. I can't tell you everything right now because of the shortness of time. I decided to concentrate on what's now is the more important. For example, now we are helping Israel to reopen our school system by devising what we call a safe class method to open our education system. And I'll conclude with the words of a very smart person, Charles Darwin, the father of evolution, that said, it is not the strongest of the species that survive, not the most intelligent that survive, it is the one most adaptable to change. So now I think I have some time for questions.
Thank you very much, Professor Afek. It was fascinating. I think the lecture was very good. Any questions for Professor Afek? You can raise questions by chat as well. Maybe we should give a short example for operation management in hospitals in African countries, or any other suggestions that you might have?
Well, I would say like that. Every country has its infrastructure and its abilities. I truly understand that what we have here in Israel, not every country in the world shares. And by the way, I can tell you that we in Israel don't have the assets of the UK or the USA, which are much bigger, richer than we are. But there is one thing which is common to all countries, and it does not depend on how rich you are. It's the mind of our people. And I am sure that in other countries, in Africa, in many other countries, there are young and bright people who are the future of your own country. So what we do, what I do in Israel, part of my work here is to try to find them out and to bring them to Sheba. That's why we opened the Re-Innovation Center. So instead of making the startups outside, they'll do it here. and I give them money for it. We give them money for that. And then once we pick up the brightest of them, we use a lot of assets even to send them to the USA, to Europe, to every place that they can learn there and come back to Israel with their experience. Because we believe that by sharing knowledge, by working with other people, there is so much to gain. So again, also with you, we'd love to share. We have people coming to Sheba from other countries, learning here, studying here, being part of us, because Israelis are very, very open people. And then we know that once they'll go back to their own country, they'll bring the message that health can be a bridge to peace.
Thank you for those inspiring words. We have another question at the chat. What would you advise for a new medical center opening in 2021 to consider during the planning in the aspect of operation management?
Well, first you have to try to find out and ask yourself, what is your vision? And your vision comes out from the place you are. I mean, if you are a community hospital, you should have a vision of a community hospital, which is wonderful for its own people. If I was the head, instead of an internationally leading hospital, to a hospital like a small hospital, let's say in the north or the Lake of Galilee in Israel, then I would bring myself to have a vision that is relative to this area, to be a leading, to be attractive, to get the best mind. Create your relationship with the community. The community is part of you. You should become a hub, a center. Third, don't concentrate just on health. Hospital in the future should be something different. It should be a hub, a center. For example, we have near us, they are opening a new education center. The city, our city of Ramat Gan, is opening a new center, education center with high school. And we told them, the fact that there is Sheba near you, bring you the kids to us, let them see here, work here. We take the brightest of them and connect them with our residents. So we are part of the education system. Then companies, industry comes to us and we say them, around us, there is industrial areas, open or commerce centers, open your hub here and let's work together. Be open, don't be afraid. And don't look yourself just as medicine or health. Think big, think large, and try to find all the opportunities around you because medicine is going to be different. There's one thing I didn't speak about, which I should mention. We realized that telemedicine is the future. So what we did, we opened a new hospital in Sheba. It's called Sheba Beyond. For example, our patients right now are in the Emirates. We have patients over the world. And we have patients not just in the hospital in Israel. People are being taken care of their own homes. People with diabetes are being cared by our endocrinology center through sensors all over Israel. Think new, think big. Don't confine yourself to the classical internal words, surgical words, and always believe and always trust your people. There is not a bigger assets than you have than your own people, and they can do wonderful. Don't even think otherwise. I'm sure they can do, once they get the right education, the right opportunity, they'll do wonderful. I'm sure.
Thank you very much, Professor Peck. Any more questions before we move? If not, I will thank you once again for joining us today. It was an inspiring and very interesting lecture, and we are very privileged to have you with us. So thank you. And I would like to invite Amma from HIG Group to say a few words.
Hello, everyone, and thank you very much. Just getting my video on right. I think it's been a very inspiring presentation. Thank you. I just want to thank you all for your time. And I hope that you've had an inspiring session just like me. I would like to also remind everyone that please look out for information regarding the next session so that you'll be able to join on time and get the full benefit of the training program. And also, if there's any theme or topic that you wish would have been touched on, just reach out to myself or anyone from the Israeli embassy, and then we'll see if we can add it. And my CEO, Mr. Kwabena Nyarko, would like to say a few words as well. Thank you.
Yeah. Hello, everybody. I just also like to just say a big thank you. I think it's been a very useful collaboration. The last speaker's comments on the value of ICT and the need to think outside the box, I think are very key takeaways for me. And as we look to develop our project, we will certainly keep that in mind. So thank you all very much, and thanks for the collaboration. Thank you.
Thank you all. I added some words. No? Okay. Thank you so much for everyone who participated today. Our next session will be on the 18th of August, same time, 1 p.m. Israel time, 10 a.m. Ghana time. See you for the next fascinating lecture in a week. Thank you for taking your time.
Thank you very much.
Thank you. Bye-bye.
Thank you.
Thank you.